Hello, everybody. I am Karthik Sharma, Associate Editor in Elets Techno Media Private Limited, and I welcome all of you here for a very special segment that Elets Techno Media does, which is Innovation Talk. In this Innovation Talk, we interview and we interact with the leaders and the achievers who are doing great work and are creating change in various sectors, be it a health sector, education sector, banking sector, government sector, and be these leaders are from private sector, even the domain of government, and also in various social sectors. So in innovation talk, the person talks about how that person and his or her organization is bringing change on ground through innovations. And today we are very happy to introduce you all to Mr. Rajesh R. Singh, who is CEO of Wish Foundation. Wish Foundation is not a new name in the health sector of India. They are working in health sector of India from quite long time now, and bringing great changes in people's lives through their noble work and through their innovations particularly. So to interview Mr. Rajesh Singh, we have here Dr. Ravi Gupta, who is founder and CEO of Elets Techno Media, and he will be interviewing Mr. Rajesh Singh, CEO of Wish Foundation, and will be talking about various aspects of Wish Foundation is working in India towards the betterment of the people and promoting and leveraging innovations to improve the lives of people. Dr. Ravi Gupta, I'll request you to please take the interaction forward. And welcome,
Sure.
Mr. Raj, to start with.
Thank you, Karthik, and let me welcome Rajesh Singh, Wish Foundation CEO, with us. It's an honor and a privilege to have him with us. And as you are all aware, that eHealth magazine and Elets has been promoting innovations in healthcare for the last 15 years. And this is a great privilege to have one of the leading NGOs in India, Wish Foundation, and specifically they are the people who are pioneers in the health sector, and their work in the field of primary health care is well recognized, very well known, and very well respected. So Rajesh ji, let's start this interaction, and I welcome you and thanks for joining us. Namaskar.
Thank you very much, Ravi, for having me here, and thanks for inviting me to be part of this interview. Really appreciate it.
Sure. Rajesh, in these times of COVID, uh, um, Wish Foundation has taken a lot of initiatives. So if you can explain about it, it will be very nice.
Well, then, when the COVID came, the wave one and the wave two, we were at the front of that because what really impacted is the last mile. And being in the primary healthcare domain, both rural and urban, we were in a better situation at that point of time to really A, create awareness, B, provide services, bring technology into providing those services, having access and knowledge to the digital health and telemedicine over a period of time. It was easier for us to really provide that kind of mandates within the various state and states scope of work. Each and everything that we did it under the aegis of the state national health mission, because our mandate, our MOU, our bindings are very clear that each and everything we will do, we have to really do this under the larger ambit and gambit of the state's response to the COVID there. Having said that, we also, the wave two really impacted all of us. We were really hoping that we have come out gradually out of that, but it hit us hard and it hit each and every individual. And we saw this also an opportunity to really contribute. So we started setting up, and as an agency primarily working on health and healthcare, we had a responsibility towards the society and the nation at large. So we started setting up a COVID care center under the larger gambit of the state health mission there. We did it both in the public and the private domain. We are running a major campaign between the wave one and wave two about how to really, so whole about how to prevent and how to really protect. Uh, for the initial period, we also did a massive campaign on promoting the vaccination, going for testing, and this really started paying some dividend. We continue to really provide supports. We are aiming that in the next month or two, we will be setting up around 500 plus beds. We have different donors, both national, international, who are supporting us, and we are grateful and thankful to all of them who have really supported us in this crucial juncture there.
Fantastic. It's heartening to see that in these times which were very, very disastrous, your organization has taken this initiative. Let me ask you that you have worked with several state governments, several bodies of the central government in the health sector, and what's your views about that? Uh, how do we make our health ecosystem more robust? Since and these times of corona have again highlighted that health is one of the most important sectors of social welfare and human welfare, and attention to the health agenda is becoming more important both for the central agencies, state agencies, and also for the private sector. So your inputs based on your experience, Rajesh.
I think we all know that the second wave has exposed, the our preparedness toward dealing with such kind of waves there. But in one way, if you really said, it also helped us in preparing for any such kind of future waves if it happen, or pandemic if really happens. God forbid, and if that happens, I think our systems are getting better prepared. And this is a best example where the private sector, the public sector, the non-profit sector, they all came together and we started working in tandem with each other there. I think state is very receptive in each and every state, if you really see this, where we are working or not working, even those states are very receptive for any help. um, the reason for doing a coordinated kind of effort is that we want to really avoid any duplication, because resources are limited, and so working under the larger mandate of the health system and national health mission, it's easier for us to really work in a coordinated effort there. And if we all are working together, I'm very hopeful that that the speak that we have seen, and we hear that the third wave is imminent. That's just all coordinated effort, the working together in tandem with the states and the private sector and non-profit sectors preparedness. This will all help us in forming this kind of convergent, a synergistic approach to deal with any future kind of epidemic or pandemic for per se there. Strategies are very clear. It has evolved over a period of time. I think we all have really had greater and deeper faith the way health system started responding. It took a bit of time, like as I said right in the beginning, that we got exposed, but by the time we realized, it damaged to a certain extent. The good thing is that we were just trying to track how the wave really moves, and we realized that somewhere around 6th or 7th of June was the peak, and it started slowing down, except some of the states where it's still showing some larger impact. States like Bihar, states like West Bengal, states like Assam has started showing the decrease is not as in comparison to other parts of the country. This also gave us an opportunity to learn from each other. So the various models of how working in tandem and how to really prepare, the famous Mumbai model of preparedness for oxygen and lack of oxygen is known. And both the center and the states are trying to emulate. It also, the larger community really also realized the importance of private sector in this, because the private sector really had played and will continue to play a critical role there. And I'm grateful and thankful to each and every private sector that many of the private sector converted their beds into 100% COVID bed, or a sizable portion of the beds into the COVID beds there. And I think great that both the state and corporates and nonprofit even collaborated with the private sector, including my own foundation. We are working with big private hospitals there, and especially helping them in increasing the number of the beds there, bringing the ICU beds there, bringing the ventilators there, helping them in strengthening the oxygen plants there, or installing new oxygen plants of high capacity there. And that's the good thing that I have seen, that bringing the kind of convergence and synergy of each and every actor and player there.
Sure, Rajesh. I think thanks for highlighting this role of private sector here, which has played a very important role. And let me ask you another question that our honorable Prime Minister has said that he wants to see a lot more NGOs participating in this COVID relief programs and helping the government in dealing with the COVID situation. How do you see the role of NGOs, and especially your organization is a not-for-profit organization? So how do you see this sector uh, playing a role in improving the healthcare ecosystem of the country?
You know, Traditionally, if you see this, like private sector and the non-profit sector has really been critical to the demand generation side, and having presence in every nook and corner, and especially the where the system had a challenge in reaching out, be it the tribal areas, be it hard to reach areas. You will see that the non-profit had a presence there. They were, with their long-term presence, they had a rapport with the community. The community and the leadership, community leadership, had a respect for those non-profits there. So I will say that I think it's a critical, and honorable Prime Minister, the Niti Aayog also came out with a strategy. I'm gladfully part of the group called Impact Group Action Group 3 under the aegis of the CEO Niti Aayog, and they are very supportive and appreciative of the non-profits support at this point of time, and even in the COVID-1 right there. The model, some of our learnings, they're very eager to really document and share with a wider geography, so others don't need to really reinvent the wheel, and simply really emulate it and replicate it there. Also, this whole access to the larger community base, the best part is that this risk communication and community engagement for the COVID related appropriate behavior, non-profit can really play a fantastic role there. One set of group that get always excluded is the women. And if you see, there's the self-help group, the Mahila Arogya Samitis, the women's group, the adolescent girls group. So non-profit having access to and confidence in, because they have been part and parcel in building, strengthening, over a period of time, they have easy access to the masses, and I think it's critical that such kind of groups should come forward and have come forward in this testing period, and worked in tandem with the state, with the government, to really respond on time.
Sure. And as we are in this interview, and we are discussing the things about the COVID situation, we are like seeing a trend that in the urban centers, the COVID situation is a bit improving, cases are dropping, but in the rural hinterlands, the numbers are increasing. And in the rural areas, there are not many private hospitals, and many of the places, public health centers are the only source for support in terms of health for a population. So how do you see the importance of PHCs, and how the role of PHCs has evolved and will evolve in this situation, Rajesh?
I think PHC was and continue to be the backbone of health services for the last mile there. And I think there are recent guidelines where CHC, not PHC, can be really used it, but even PHC can be really used if government really permits as an isolation ward. Like there you can easily set up a temporary one or an extension one. The COVID care centers, which are the government is promoting currently, if we really see the clear guidelines there, that can be easily really set up across the various PHC where their needs are larger. As you rightly said, that the wave is moving more towards as it continues to impact the urban, it's also started moving towards the rural side and rural areas of UP, Bihar. The numbers really speaks about that. Are clearly started getting impacted heavily, and I think PHCs, even CS, all these health facilities can play a critical role. A simple five-bedded one, where the cases can be really handled, monitored by a nurse or an A&M or a GNM. Setting up a COVID care center, a temporary center, can easily be done by these. Even the government has come out that even Ayush and others can really provide in the L1 COVID care centers or step down COVID care centers there. We set up a COVID care center like initially in an urban PHC corner. It was simply a corner, a room which was not utilized, a hall which was not utilized for ages, and we just quickly just kind of painted it, and we put the beds there, and 10 bed were put within 7 days time there. And now people who, so what it really helped, and it's really very good case study, that people who have recovered and stabilized from the L2 or L3, especially L2, they get, but they still need ambulatory care. They move to these L1 centers where there are doctors, where there are nurses, 24/7 kind of care there. They move it. What happened in the tertiary L1, L2, L3 there, the bed gets vacated, and someone who needs that gets really that bed there. So I think it's critical. And same with the rural areas where people needs to really be monitored by a healthcare providers, and the situation is moderate there. These primary health centers can easily be converted into a transition COVID care centers there, or an extension COVID care centers till the need be.
So Rajeshi, let's start with the origins of this Wish Foundation. How it all started? What was the vision when this foundation was formed, and how has that vision evolved over the years?
Well, I think this foundation really actually started working in 2013-14. At that point of time, we realized that an area that there's a big gap and need is, transforming the whole primary healthcare. It was evident that the primary healthcare can be a backbone for any, maternal child health intervention, any disease intervention. And we realized that using that opportunity as a gap, we brought, this whole concept of, primary health and digital health. We also really brought the concept of medical technology within the primary health domain there. So having these three components, converged into one, we took up a sizable portion of primary health in Rajasthan, and Rajasthan at that point of time was very open for such kind of transformative work within the primary health, with a very clear measurement metrics there, especially to show an impact on maternal child health outcomes there.
Rajeshi, you have mentioned that your organization is right now working in several states, also with the central government, NHA, and various other agencies. How are you seeing the road ahead for Wish Foundation? What is the vision? What is the dream you have?
Well, I think we feel we what we have been really mandated over the period of time. We feel that the primary health will be an area that it needs institutions like us to really contribute, strengthen, support there. It also requires institution which has the capacity, which has the technical capacity to really continue supporting. So we not only manage these health center, but we also move to a more advisory services or technical support roles in various states where we are supporting states in using our knowledge and wisdom to really scale the model or the model which government has, like especially vis-a-vis primary health there. So this new term called primary comprehensive primary health care, which came up 2 years back, when the honorable Prime Minister, you know, formed this, um, you know, PMJ program. The PMJ had two verticals there. One was the insurance part, and the second was our Ayushman Bharat program. The first was the insurance one, and the second one was strengthening the whole primary healthcare centers there. And the scope of the primary healthcare expanded from maternal child health and communicable disease only to add non-communicable disease, to add mental health, to add geriatric, to add wellness part there. And so state needs institutions and a non-profit agencies like us, who is willing to and who has capacity to support them in strengthening that response, and scaling that, the whole mandate of comprehensive primary health within the state there. And we see a larger role of institutions like us, not only our institution, but there are other institutions who can really play a critical role in that domain there. And now that COVID has really again taught us a big lesson, it's important that we really continue to work in a coordinated way between and amongst us.
So I think, Rajesh, if you allow, I will. We can end this session here, and I will request you to give your concluding remarks in terms of uh, how you think that the healthcare ecosystem, your vision, like if like how do you see the next 5 years or a change may happen in this country in terms of healthcare infrastructure and healthcare ecosystem. So we will conclude with that.
Thank you, Ravi. Thank you very much. As I said, I think this has given us a great opportunity to leverage each other's strength, and let's really continue using that strategy over a period of time. Let's really work with a coordinated way, and I think this is the best time that we learn from each other, that we started believing, respecting in each other's experience model more and more. And I think if we continue to with that kind of strategy, the camaraderie, I see that we can really defeat many more waves, and we can really handle the many more waves of such kind of pandemics, which shouldn't really happen. But if it happen as a country and we will be really prepared for this. I also really, appeal through this, platform that let's really strengthen our primary health. Let's really focus on our primary. Let's really make our primary health robust one, so that in coming years and months we don't have to really run away, run left, right, center if such kind of situation arises there. I might the data really talks about that almost 65 to 70% of the cases that really goes to the tertiary care, especially, and the tertiary care loads really happens can easily be dealt at the primary care. These are simple cases of cough, cold, skin diseases, like no, these fever, these can be easily handled. So if we can really strengthen that part, it can really ease burden from the tertiary care, and the tertiary care can focus on what they're really meant to do there. And I'm really very thankful to Elets, and I'm thankful to the various states that we are working, that they give us the opportunity to really support them in this endeavor. And let's really keep working. Let's really make save each and every life if possible there. For us, we believe in that if we save one life, I think that really makes a difference, and that shows our work. So thank you very much, Ravi, again.
Thank you, Rajesh. It was such a pleasure to talk to you, and I learned so much from you in the last 1 hour. So thank you so much. Thank you.
Pleasure
That
is
was,
mine too. Thank you.
yeah.
Pleasure is mine. Thank you. Bye bye.